Hi, my name is Shirley Pouvian, and in this lecture, we're going to cover the cardiac cycle. One of the things that's really hard to understand can be the cardiac cycle graph. So we're going to decipher this graph and get a better understanding of what the information that this graph is actually representing. First thing you need to know about is that this graph is recording the pressure over time. So let's begin. We're going to start with the very bottom, the row at the bottom, which is the phonocardiogram. The phonocardiogram is really representing the heart sound. So there is a total of 4 heart sounds in the heart. This represents the first heart sound, which is the closure of the mitral and the tricuspid valve. Then we have the second heart sound, which is the closure of the aortic and pulmonic valve. These 2 heart sounds are normally easier to hear during auscultation. Then we have the third heart sound. It's a little bit smaller. It's the early diastolic ventricular inflow. So this is when the blood is entering the ventricle and hitting a stiff ventricular wall. Then we have the fourth heart sound, which normally would be here. It's a little faint, and the phonocardiogram didn't even pick it up. It is the atrial contraction. Now let's look at the second line from the bottom up. We have the electrocardiogram. So with the EKG, we know that we have a P wave, also known as atrial depolarization. We have the QRX complex, known for ventricular depolarization. Then we have the T wave, which is ventricular repolarization. Now this red line here represents the ventricular volume. So this is the amount of blood that is inside the ventricle during the cardiac cycle. Now if we look up a little bit higher, we notice that there's a gray line. This is the atrial pressure. The blue line is the ventricular pressure. And the gray line at the very top is the aortic artery pressure. Okay, so now that we have a better understanding of what all these lines represent and what they mean, let's go a little bit deeper at looking at what happens when the heart actually contracts, what happened during a cardiac cycle. So we have a heart here, and we have the pressures that are written right along the side here. So we know that when the heart contracts, there is other than the impulse that is sent to tell the heart to contract, there's also a pressure gradient happening inside of the heart. The atriums, we know them to rise to be a little bit lower in pressure. Right here, we have the right atrium at 4 millimeters of mercury, left atrium from 8 to 10, sometimes 12. The ventricle, right ventricles at 25 to 4. Left ventricles at 120 to 10 millimeters of mercury. Pulmonary arteries at 25 to 10, and aorta is at 120 or 80 millimeters of mercury. So that means during systole in a normal patient, if we're looking at the right ventricle, the highest for a normal patient should be around 25 millimeters of mercury, and it can go as low as 4 millimeters of mercury. Okay, so when the heart is when there's blood entering the right atrium, we're going to start with isovolumic relaxation time. So the blood starts entering the right atrium via the IVC, SVC, and pulmonary veins. During that time, all 4 valves are closed. Mitral valve, tricuspid valve, pulmonic, and aortic valve are all closed. The ventricles at that time are going through isovolumic relaxation time. The pressure is falling in the ventricles. So if they were at 120, if the left ventricle was at 120, it's going to start falling down to get to 10 millimeters of mercury. And the same thing for the right side. It's going to go from 25 to 4 millimeters of mercury. As the pressure continues to fall, we start having a pressure gradient. Once the right side and the left side reach the 4 millimeters and 10 millimeters of mercury, there's a pressure gradient because now the atrial pressures are now higher than that of the ventricle. So immediately the valves will open up because the pressure in the atriums are higher and starts dumping the blood that has been collecting into the ventricle. This is also known as the free filling. During the free filling, and also the third heart sound that we hear, because during the free filling, that's when we have, during early diastole, we have blood starts falling into the ventricle and hitting the stiff wall of the ventricle. While the ventricle continues to fill up with blood, the pressure in the ventricles now starts to rise. As the pressure rises, now the mitral valve and the tricuspid valve tries to close, and the atrium contracts to push the remaining blood in the chamber inside the ventricles before the valves close completely. This is normally seen when we do our ultrasound with the E and A waves. We see the E wave as the free filling. So this is when the ventricle pressure is at its lowest, the atrial pressure is higher, the atrium starts dumping the blood, free filling, the pressure starts to rise, and then the atrial kick happens, atrial contracts, and push the rest of that blood inside the ventricle before the mitral valve and the tricuspid valve completely closes. Once the valves close, all four valves are closed now, we go through what's called the isovolumic contraction time. During the isovolumic contraction time, the left ventricle and the right ventricle are going to start increasing in pressure. They're going to go from 4 millimeters of mercury to 25 millimeters of mercury. Same thing with the left side. It's going to go from 10 millimeters of mercury to 120 millimeters of mercury to be, and sometimes a little bit higher, okay, to open up these valves. So once the ventricles reach their ideal pressure and a little bit higher than the arteries, the aortic valve and pulmonic valve will open up, and the left ventricle and the right ventricle will contract and start ejecting the blood into the systemic system and the pulmonic system. So I hope this explains a little bit more for you. Now we're going to go back into the graph. So let's look at what's happening with this graph. If we start here on this edge, this is right before the pressure in the ventricle is already starting to rise. The mitral valve is starting to close, and here's the P wave. We have atrial depolarization and the atrial contracts. Once the atrial contracts, if we look at the ventricular volume, we notice that there's an increase in volume during the contraction. So this is what this section is actually telling us. There is the atrial contraction. Free filling is still happening right towards the end right here. If you can just imagine it right here, or we can look at it right over here. And the pressure starts to rise in the ventricle, and mitral valve starts to close. Atrial contracts. Here's the depolarization. Pushes the rest of the blood in the ventricle, and then mitral valve closes. Then we hear the first heart sound. Now the heart is going to go through isovolumic contraction time. During that time, you'll get the QRX complex, okay, because the ventricle is getting ready to contract. The volume of blood will remain the same because all four valves are closed. And the pressure in the ventricle, however, is increasing because now it has to go from 4 or 10 millimeters of mercury up to 120 or a little bit higher in order to eject the blood. So as the pressure rises, then the aortic valve opens up. Once the aortic valve opens up, we have our QRX complex. We see that the blood in the ventricle just starts ejecting into the systemic system. Notice that the pressure in the ventricle is slightly higher than that of the aorta. Now, if we're looking at the volume, you'll notice that the volume of blood is reduced significantly because most of that blood is going to be ejected into the systemic system. Once the blood is ejected, pressure starts to fall again. Aortic valve closes. Then we go through isovolumic relaxation time. And during that time, all 4 valves are closed. Both the semilunar and atrioventricular valves are all closed. And the pressure in the ventricle starts to fall. The volume remains the same. And remember, we said this waveform is the ventricular repolarization. So this is really getting the muscles ready to just relax. So you have the T wave occurs, and then you have relaxation time. So now that the pressure has reduced significantly in the ventricle, notice that it goes below that of the atrium. So the atrial pressure rises high, and when you look at the volume, you notice there's a significant increase in blood volume right when the ventricle, right here, the mitral valve opens up, and you notice that there's an increase in blood, and the pressure of the ventricle is less than that of the aorta, of the atrium, sorry. So as the pressure continues, as the blood continues to fill the ventricle, the pressure in the ventricle just starts to rise just slightly, causing the mitral valve to close. Then we have our P wave. Atrial contracts up here and dumps the remaining blood in the chamber, and we go through the entire cycle over again. Okay, so now that we've gone over a normal graft, let's look at what happens when we're dealing with a patient that has disease. So this patient has aortic stenosis. So we know that with aortic stenosis, there's a narrow in the aortic valve. So the valve is not at its normal size. So there's going to be an increase in pressure. So let's look at this. The atrial pressure will still be higher than the ventricle because there's nothing wrong. The valve that is between the atrium and the ventricle is mitral valve, and there's nothing wrong with the mitral valve. So the atrial pressure will be higher than that of the ventricle, just slightly higher. Then we go through isovolumic contraction time, and we notice the ventricle rises. But what happens here, there's an even higher, significant increase in pressure, all the way up to like 200 millimeters of mercury in the ventricle. And this is normally because the ventricle has to work a lot harder to push the blood through a stenotic valve. So the pressure in the ventricle is going to increase significantly. And then once the blood is ejected, you notice that the aortic valve will close, the ventricle will go through isovolumic relaxation time, and the pressure will fall, and everything else will remain the same. But the only thing that's different from the first graph is that there's a significant increase of the ventricular pressure than the aortic pressure. Let's look at mitral stenosis. So with mitral stenosis, we know that the mitral valve will be stenotic. So there's going to be an increase in pressure in the atrium. So the atrial pressure will be significantly higher than that of the ventricle. Sometimes the ventricle can also reduce the pressure in the ventricle in order to help allow some of the blood to enter, more blood to enter in the ventricle. So once the atrial contracts, mitral valve closes, and the heart will go through isovolumic contraction time, and the pressure will increase. Everything else will remain the same. Notice that the ventricle is slightly higher than the aortic pressure during ejection, then the valves will close. But as soon as isovolumic relaxation time is over, you notice the increase in the atrial pressure. This is due to a patient with mitral stenosis. I hope this was able to help you understand the graph and get a better understanding of what this graph information is actually giving you. Please leave me a comment, and thank you for watching.